You're listening to This Might Sting a Little,
the podcast where three doctors tackle medicine, myths, and madness.
With a healthy dose of sarcasm.
I'm Dr. Duncan Turner.
I'm Dr. Dennis Hughes.
And I'm Dr. Aurel Swenson.
This is No Wine Fest. It's about to get clinical with a twist.
For today's podcast, part of what we're going to cover is, as the title goes, the death of expertise. Why everyone seems to think they're a physician or at least an expert as it pertains to any aspect of healthcare you can find, whether it's TikTok, Instagram, whatnot. Every single person out there seems to claim to know what the doctors are doing wrong, what medicine's doing wrong, and how to do it better and how to do it right. And from the most ridiculous things like how to wand your water so it tastes better to less ridiculous things in terms of how certain supplements and foods might be good for your gut, but whether or not that's appropriate for you is a whole different conversation. There's a broad spectrum of individuals out there, and many of them, all of whom seem to believe they know exactly what they're talking about, not necessarily with the credibility to back it. And they position themselves in a very consumer-friendly way, which I think is one of the biggest things to tackle as we approach this, right? Which is, what is it that allows people to think they're experts when they're not? And that part of that can be some of the tools that people have access to, including increasingly AI. And perhaps what is it that true experts are missing? Again, for a lot of physicians, and again, I'm prepping the conversation a little bit, is we're not self-promoting by nature. And we believe that our degrees and our experience are supposed to speak for themselves and stand alone. But that's not the case in the modern, let's call it social media world, where you can be the best of the best, but nobody cares if you can't make a name for yourself. And that is not what most experts strive to do. So with that said, I guess we'll kick it off in terms of, I guess we'll start off, Dennis. I know you have quite the gripe with AI in terms of how it affects what patients are bringing to the table, their questions, their reliance on it. Certainly, this is in some ways nothing more than an evolution of what we were seeing with quote-unquote Dr. Google and WebMD searches for the past decade or so. But this takes it up in a new level. People think they're getting even more robust answers because of the way AI presents itself. And I'm curious to see where you stand on that and what your thoughts are around it.
First, I think people are overconfident about AI. I think that a lot of people hold this idea that I put in my symptoms, out comes the answer or answers. That makes logical sense to me. That's what it must be. There's this phrase I like to use, confirmation bias, which means when somebody has a strong idea about something, it can be very hard to dissuade that person from that idea they have. Republicans and Democrats, perfect example of confirmation bias. You can have two intelligent people sitting across the table from each other having a conversation, and they might be privy to the same news, yet because they're biased, they're going to each take their own positions, unyieldingly. And sometimes when people call me, they've already looked into AI to address their symptoms, and now they're biased, or maybe their friend has had similar symptoms and told them, you know what, I know what this is what I had, it's the same as what you have, you need to tell your doctor to look into this is what you have. And they've got this entrenched idea about something, whereas me as a physician, I'm going to probably come to your symptoms differently I'm going to have a broad differential. I'm going to use my experience and my training over 25 years to try and whittle away at your symptoms and your exam and come to a conclusion. A quick answer from AI is not going to match that. I think that AI can be a helpful tool, but when someone calls me and says, my AI told me, it's always my AI. They own it. My AI told me I have this, and now I got to spend 10 minutes dissuading them from jumping the gun. Say, wait a minute, let's have a conversation first. Let's dive into this in a broad fashion so that we can make sure we don't miss anything. And sometimes two different things in the same person are causing the symptoms, not just one thing. I'm not against using computers or searching. I search when I research, but I just don't think that using a computer search is a proper way to diagnose your symptoms. It's a discussion.
I'm going to put you on the spot a little bit, though. How do you reconcile that with the budding AI software that is driven and aimed at physicians to use for accelerating diagnostic capabilities, synchronizing and synthesizing lab results, putting out succinct summaries quickly, And I have my own 2 cents, but I'm curious as to how you reconcile that, because I think that's what's going on for the patients too. My doctors use AI. In fact, I think California and a few states passed laws saying if you use AI in your medical note, you must disclose it because it's becoming that commonplace.
I don't.
Fair enough.
I
but-
think because there is a human element to the discussion whereby you address their symptoms and signs. And some people don't have the wherewithal to put their symptoms into words that make sense. You have to juke and jive a little bit with the conversation. Oh, I really didn't mean that, the thing I just said. I meant this other thing. It's that human element in conversation which really brings things into better light. Whereas I just don't see a computer doing that as well. And I think our brains are just going to shrink if we over-rely on these instruments because we're in a hurry. That's why I'm thankful I have this small boutique practice, because I can take the time. I don't have to rush. Probably what you're saying is really helpful when someone's jammed and they're just running from room to room. But I don't have to do that, thankfully. I don't want to rely on AI to tell me what test I should order or what I should infer based on what the patient's saying. I'm not fully against computers. I use computers. I use technology. That's just, I think that we all have our training and skills, and I think we should use them.
I think there's a real risk that is going to happen with AI, and has probably already got some grip on the whole structure of things, which is in medical education.
Yes.
We've trained over years, and there's been hours of time that we've spent in the trenches with the patients, and nothing can beat that experience, because we don't always recall that experience when we're faced with a particular patient, but there might be subconscious
Muscle
jogging
memory.
of the
There
memory,
is, yep.
muscle memory of moving you in a direction. Now, I think that AI has a real place in the urgent circumstances, as you said, because you don't want to miss something. And there's a very good chance that AI will prevent you from missing something, because it will be the relatively common things that will come up there, but there'll be a long list of things that can happen, because they could be side effects or otherwise. But I think where I see the problem is that it's being relied on completely. And it's also it's being abused by medical students, or students of medicine. Actually don't have to actually officially be a medical student. Okay. That makes it really concerning. But I can definitely see some benefits from it, but I can see a real problem in terms of, are people getting trained well enough to do it? Is your brain going to shrink because we didn't have to think about this? Yeah, it will. And I know you're using that figuratively, but there's a bit of truth in it. That if we don't continue to exercise our brain and keep thinking about things and challenging ourselves about it, worrying about somebody that's sick, and even AI isn't telling us what it is, what we can do, that personal experience, that human response, as you were referring to, is something that can keep us out of trouble. But it's going to be an effort to stay away from it completely.
And even that human connection between physician and patient is important to discussing. Mm-hmm. That the patient trusts you, knows you for years, and is able to explain comfortably these feelings. It's not going to be the same if you're just talking to a microphone.
That's right. And I don't remember where I was saying this the other day, but it was a relatively recent circumstance I had when a patient just looked sick. Now, afebrile, lab work was okay, but she just looked sick. And I thought she had appendicitis and sent her to the ER. And she did have appendicitis. But didn't have an elevated white count, didn't have a fever. She just had some generalized abdominal pain, no guarding, no rebound, nothing really directing, but she just looked sick.
It's that old word gestalt, the feel.
And it's that you get with years of experience, or maybe quicker. It doesn't need to be that long if you're smarter, but
no, it's years. It's the 10,000 hour rule, right?
Yeah, but I do think that some of this is going to get really frustrating because patients will be more and more informed about all of these potential side effects or bizarre illnesses that they might have presenting in a fashion that's going to be a challenge to us to dispel or get past.
It's easier to deal with my current practice where I have more time, but at UCLA where I had 15 minutes, if someone came in the office and said, I know what I have, and I have to spend 10 minutes dissuading you from the fact that you jumped the gun, it's not likely that you have what you think you have. Now I've got 5 minutes left before I have to run on to the next patient.
Yeah.
I think,
again, I think that's right.
In my experience, if you know a patient over the years and they've learned to trust you, they trust your skill and experience, that you're listening to them. I think that's a little bit less of a factor. It's not going to be zero, but it's a little bit less.
Yeah.
I think that as far as it pertains to the top of the conversation too, though, it's the AI as it currently exists can give a lot of false confidence to make somebody think they're an expert. It's very easy to type in there, is ashwagandha good for your brain? And give you a whole, yeah, it's great. And then you can get online and talk about ashwagandha root and how it does this and that for you and blah, 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 blah. And all of a sudden you're an expert. Yep. You didn't ask what are the side effects and what are the risk profiles and how does it interact with medications and can it cause this or what's very simple to empower people to appear to be experts. Certainly AI has made that easier. The web made it easy anyways, but AI has made it much easier. So it certainly feeds into that.
I read something by Dr. Peter Attia yesterday, and he was talking about the influencer often believes they know more than they really do.
Yep.
And a trained physician knows more about what they don't know. They're aware about how expansive it is, that you have to know all these things if you want to be good.
Yep. There's a reason there's so many specialists in medicine. There's a lot to know.
There's a lot to know.
Yeah. I think part of the other thing we'll redirect a little bit with respect to the everyone's an expert mentality is also pandering to a consumer explosion in terms of consumer-driven healthcare. And you can see this with Hims and Hers and Ro and all these online shops now where
Ultra Human.
Yep. You can hop on there, exactly, fill out a form because I want testosterone. I want whatever. I want my ED pill. I want my this. You don't really care if it's the right thing for you or not because you assume that if you want it and some influencer told you it's good for you, there's this cursory medical screening, you submit your form, whatever it might be, and you're good to go. And it misses a lot of the nuance there. Again, my opinion, right? As we increase the consumer-driven aspect of medicine, it further empowers, we'll call it these soft experts, these non-experts who say, oh, it's easy. I'll just tell you that because your libido is low, you must need testosterone. There can't be anything else behind it but your low T because you're over 50, let's get you on T. And they don't take the time to think through this, of course, or they're not empowered to have a full conversation around maybe you're 50 but still want kids. Or maybe this, or maybe that. I don't know if you've seen that kind of from your practice in particular.
I really haven't. I think that I'm lucky that patients have done some research before I see them and have not, if they're going to go into one of those directions of a phone call they can make to get onto a particular medication, I don't think that they have been brave enough to do that so far.
Fair enough. I tell you, I certainly see it on the stem cell side.
Yeah, I bet.
Where everybody's like, the advertisements of come and get stem cells, whether there's several franchises around where you can go in and consumer-directed stem cells in the U.S., out of the U.S. Yeah. It'll cure this, it'll heal that, and no conversation about risks and benefits and all the magic behind stem cells. Oh, yeah, sure. And what are they good for? What are they not good for? How do you prep the environment in the body beforehand? No, it's just a consumer-driven approach to medicine, and it's very easy to pander to that because it's an easier business model, right?
Oh,
I just got on a
for
podcast
sure.
and say, everybody who's got joint pain should come see me for stem cells. By the way, you should. But didn't bother to have the conversation around who's it going to benefit, who's not a good candidate, what are the risks and benefits, etc. It's much easier to sell the glitzy aspect. And it's easy to look like an expert when you just sell the glitz, which I think we see a lot of in, again, that I'm calling it consumer-driven healthcare, for lack of a better term.
It can be pretty persuasive.
Yes, it can, and it's working quite well. Again, we have very large companies across the country doing, whether it's longevity, whether it's hormone replacement, whether it's supplement companies that are physician-backed or not, who knows. We see a lot of that.
No different than the influencers on YouTube. People really respond to those people. They have a certain knack of wrapping you around their finger and being credible.
Just make it sound shiny and fun.
Yeah,
If you make it shiny and fun, people want to buy it.
they're good at it.
If you have a medical conversation, it's not very fun.
Right.
A perfect example today. I saw a 37-year-old guy today. His total testosterone was 190, which for the listener is really low for a person, especially if they're 37 years old, when it should be 700 or
At
so.
least 500.
Yeah. And I had to sit down and have a talk with him. I was trying to whittle away why it was so low. I did all the usual tests we should do, prolactin, LH, FSH. All of it was normal. Well, the LH was inappropriately low. But I started to wonder what his sleep was like because, as you guys know, the testosterone is secreted in sleep. And he said, on the low end, I might get 3 or 4 hours of sleep a night because I watch TikTok all night and other videos. So I started to wonder if maybe impaired sleep, inadequate sleep was the cause of his low testosterone level. So we agreed that he was going to put that down at nighttime and get some better sleep and recheck his testosterone later instead of jumping the gun and putting him on a supplement right away. Obviously, a 37-year-old, he's not with anybody, and I'm worried that if I put him on testosterone, it might impair his fertility later in life. Maybe not. I had to have that discussion, and I don't know if you go on this consumer-driven testosterone replacement, it seems doubtful to me they're going to even talk about that.
Why would they?
Oh, no.
Yeah.
That's not how you sell product.
They have no drive or need to do that. They want to sell their product.
Yeah.
Just one example.
One of many, to be sure.
It's very tempting, I think, for patients to get that easy way out. Somehow, for some reason, hormones in women, as people seem less inclined to do this on their own, of taking the advice of an influencer or getting online about it and just with a phone call and getting something because it's relatively safe to do, and all we're talking about is a little boost of that. And frankly, there's probably not the drive for women to get estrogen from an organization like that then go to their own doctor and get it if they're the right sort of age for it, or at least have a conversation. And most of those patients would have a physician capable of it. So they don't have the stigma of going to a doc and getting a testosterone level that's very low and frightening. And so they would be more, I think there's a less resistance for a guy to call up or make a phone call to get a brown paper package delivered the next day with testosterone in it than there would be for a woman to do it with estrogen. It's a guess.
It's a different advertising angle too, right? It's an ego-driven advertising of get muscle back, get sex drive back, feel like you're 20 years old again.
Yeah.
That's not the pitch that women are given for hormone replacement therapy. Right. So it does make for an easier sell.
It's the only upside for that, they're going to get breast cancer.
It's a very ego-driven sales pitch for guys. Yeah, but that makes it very easy to sell online.
Yeah.
You just
I don't see that much. But
yeah. That's not to say that going online is the wrong move for some people. It's just a matter of, again, are you getting a good evaluation relative to other causes, other treatment approaches, whether it's sleep, whether it's get to the gym more. All these things matter for your general health, and it should be part of the consideration.
Yeah. No, I think you're right. I just don't come across it.
So I guess kind of summary perspective there, right? It seems like it's easier than ever to make yourself look like an expert. and to believe that you are as well, because you have access to tools that can make you feel confident in a very limited area of domain expertise. It's easy to position yourself online and sound like you're an expert. You can get followers in no time. You can buy followers, in fact, which make you look even more robust very quickly. And whether we like it or not, AI tools themselves are empowering our patients, our clients, whatever you want to call them, to also feel like, hey, I know what my doctor knows. Whether we like that or not, it's true. I don't see that going away anytime soon. In fact, it seems to be getting worse by the hour.
It's going to get worse.
So just to be clear, I actually like it when patients do research. I think that might make it easier for you ultimately to be on the same page, where they'll say, oh, I read a little bit about that. I think I understand what you're saying. My main object would be if they've come to me with a pre-established self-diagnosis, which is unbreakable to them.
Yeah.
But no, my grok told me. Yeah, that's my only real issue with that, because it makes it harder to get to the bottom of things when you have that resistance. So,
yeah, I had a patient not so long ago. She came to see me for hormones, and I talked to her, and she had some risk factors, and I said, we need to do some lab work first. And she said, you're not going to write me a prescription today. And I said, no, we've got some other things we need to look at. She was furious, and she left, walked out of the office. And
Wow.
And I'm glad I didn't. I'm really glad I didn't. But it wasn't long ago.
No, I think take-home message from all this is very easy to buy into shiny, flashy things online that sound like they're experts. And the boring medical part that comes through your healthcare really still needs to be handled by your physicians. It's much more complicated than your online influencer wants to make you think it is.
Yeah. Thanks.
thank you.
Thanks, guys.